I went to a STEEP Academy training over at All Saints, and I'd heard about these human factors engineers. And as a nurse manager and a clinician, I kind of laughed at the idea of it. I say this with love. I thought human factors engineers, that sounds like a made-up job title. What could that possibly be? But it stuck in the back of my mind when I heard about it. And so as I was sitting there looking at my workflow problem, I put two and two together and realized I have a resource available to help me solve my problem. I have these two PhDs within our corporate system that could actually come in and take a look at my workflow and help me and my staff gain some sanity. So I just shot off an email to my IRN, and she said, yep, there's Yen and Adam, they can help you with your problem. And within a week, I think, we met and had this really robust discussion, a lot like what you guys just did within about 30 minutes ago, where they came in, did an initial observation, and we just shot off what was working well, what wasn't. And it was really amazing to have their outside perspective on what was working for my staff and what was frustrating my staff. My next step was I brought all my staff in, and we identified the key times of the day that were the most disruptive to them. So for my day shift nurses, it's 7 a.m. to 10 a.m., because that's your initial assessment time, that's your initial med pass time. That's when all the phone calls are going off, the docs surrounding, radiology's here, labs here. I mean, it's just, you guys know how it is, it's kind of chaotic. So we discovered what their frustrations were, and we sent them that same survey I think you guys have done with your staff here, that work environment survey. And they rated very similar to what you guys rated, which was their biggest frustrations was, number one was interruptions. And so we carry Nortel phones, we don't use pagers, we have Nortel phones. And I work in staffing on occasion, and I can speak from personal experience. In a 12-hour shift, you're averaging anywhere from 25 to 50 phone calls in a 12-hour shift. And that's an average. So imagine that I'm sitting here talking to my patient, Mr. Smith, and he's just had a cancer diagnosis, and I'm trying to work with him through that emotional aspect of it, and my phone keeps ringing. I mean, how connected do you feel? How heard do you feel when I'm sitting there talking to you and my phone's ringing? Oh, excuse me just a second, I have to answer this. Passing meds, I'm trying to scan my meds, I'm verifying their identity, and my phone just keeps going off and off and off. So as a manager, I really wanted to help them with that, reduce those interruptions, because I knew how frustrating and how dangerous that could be for them. The second piece to that was the medication administration. My unit is set up like a letter A. It's like two long hallways, and then there's one smaller connecting hallway. I have two med rooms on the two long hallways, which sounds like a great idea because, oh good, wherever my assignment is, I can have easy access to my med room. But the problem was when we were ICU level, one Pyxis was ICU meds and the other was downgrade meds. So I have completely separate meds, so they're having to run back and forth constantly to find their meds. And then the last piece that we focused on was their comfort level with the EHR, their charting and Eclipsys. They were all new to Baylor and they were all new to Eclipsys, so you can imagine the time it took them to chart in the morning took forever, and they were staying later to finish it. So after getting their input and getting the observations done, we did our time motion studies where we actually went and actually physically timed. We shadowed the nurses and we took a timer, and every task that they were doing from 7 to 10 a.m. we timed it. So that was our baseline data, because I need some sort of data to prove that this is working, right? And we thought about using incremental overtime, but we didn't have a good way to track that and prove that, so we were just going to do a time motion study. And it was amazing what I saw with my staff. If you ever get a chance to just shadow your staff, I do see the benefit in doing a different unit, but to go shadow your staff in your own unit. For example, I caught one thing, it's a workflow issue. She scanned his armband, scanned the computer, and then she asked him to verify his name and date of birth, but she was looking at his armband while he was doing that. I mean, what does that tell you? That tells you that the patient's with it. He knows who he is, he's got the right armband, but that doesn't tell me that I have the right patient up on my EMR screen. That doesn't tell me anything. So you catch little things like that when you do the time motion studies. So we got our baseline data, and then we decided to implement a patient safety time zone, which I know you're going to roll your eyes at because I read all the research on it. And like he said, you walk around in the construction vest and do not disturb, we're passing meds, which doesn't really work because nurses need to be able to be interrupted if something critical is going on.